Our next speaker, Dusan Kaf, he's a PhD director of Digitas Institute, focusing on digital policy and accessibility programs, and Masahito Kawamori, a project professor at Kilo University. I really hope I'm pronouncing it well. Special advisor ICT and Smart City, and they will both speak on inclusive telehealth platform for emergencies. I'm really interested in hearing about that. So please, thank you very much.
Okay, thank you, Mikal. Yeah, it works. Hello, everyone. My name is Dusan Saf, as Mikal said. I'm a white man with blondish brown hair. I wear glasses and a bluish shirt and a dark blue dress. I'm also honored to be here today together with Masahito. We are going to present an inclusive telehealth platform for emergencies that we have developed during the last years. I'm coming from a dynamic research, advocacy, and policy non-governmental organization, and our mission is to champion digital accessibility, ensuring that technologies serve as an empowering force for all, regardless of their abilities or the circumstances. In our work, we strive for a world where technology knows no barriers. So let's now proceed with the presentation. Now I will turn it over to Masahito for a brief introduction.
Thank you, Dusan. Thank you, Michal. Good morning, good evening, good afternoon, everyone. My name is Masahito Kawamori. Let me introduce myself briefly. I am an Oriental middle-aged man with grayish black hair, with a reddish shirt, a button down, and I'm very honored to be here. And I belong to Keio University in Tokyo, Japan, as well as I'm a rapporteur of ICT accessibility and digital health at ITU, the International Telecommunication Union, which is the specialized agency at the United Nations. I've been working with ICT accessibility with persons with disabilities within that capacity for more than 15 years, I think, already. And I'm very interested in this area. I'm very, very honored to be here. And thank you very much, Michal, for introducing me here. As well as I've been to Vienna, and I met many people there. And I'm very, very, how shall I say, inspired. And especially, Robin, thank you very much for your great organization. And today I'd like to share our endeavor on how to bring ICT to persons with disabilities, especially in emergency situations, and also especially in the area of telehealth.
If you can just fix your camera so we can see all your face, not just so we can read your lips, please. Thank you.
Okay, I'm sorry.
Perfect.
Yeah. Oh, okay. Yeah, good. So our title is Inclusive Telehealth Platform for Emergencies. Dusan and I have been working on this for more than 5 years, I think. And as you might know, on the first day of this year, January 1st, a very powerful earthquake hit the northern part of Japan. And the people there are still struggling to recover. I just got the message from one of my colleagues who are working there that over 14,000 people are still out of gas, out of water, out of electricity, and they're still trying to survive. And it was reported that about 3 meters of the ocean was raised, and so that the port became inaccessible. And so they can't bring food and water from the ocean, so they're trying to help. And this area is a peninsular area, so that it's very inaccessible from many other parts of Japan. So it's a very dire situation, and we've been trying to get access to those people, and some of our colleagues are trying to help, especially with ICT, information communication technologies. And that just happened this year in January. And Dusan, you can explain the other picture, which is on the left-hand side about the record flood in Slovenia.
Yeah, okay. Thank you, Masahito. Yes, in August last year, Slovenia experienced unprecedented disaster, the floods that had a profound impact on country's population. Among those affected, persons with disabilities, which includes those with sensory impairments, encountered significant challenges. So we discussed the situation also at the national level in the Council of Electronic Communications, and we studied also the situations of different persons who reported the difficulties. So the floods disrupted critical services, including healthcare facilities and social support networks. Access to medical assistance became compromised, affecting both persons with disabilities and their caregivers. Despite efforts to quickly restore communication networks, many individuals maintained or remained isolated and difficult to reach for days. This situation exacerbated the challenge faced by those with disabilities, and in such circumstances, distant support is essential. So this telehealth service that we are going to present today, the platform can play a crucial role in providing medical advice, emotional support also, and guidance remotely. So as you know, the global warming are causing these problems. We know that factors like heavy rainfall and local geography contributed to the severity of the floods, which hit Slovenia in a few waves, and 1/3 of the country was actually covered by water. However, this raised concerns about the potential role of climate change in increasing extreme weather events. While global warming is causing these significant changes in our climate, like temperature rise, we witness more frequent and severe natural disasters, such as hurricanes, floods, wildfires, and extreme weather events all over the world. We witnessed several heavy floods in Europe during the last few years. And these disasters have devastating effects on communities, ecosystems, and infrastructure. They lead to injuries, displacement, and loss of life. And the increasing frequency and intensity of natural disasters highlight the urgent need for effective disaster preparedness and response. Well, during natural disasters, traditional healthcare infrastructure can be impacted, and hospitals may be overwhelmed, and access to medical facilities becomes challenging. So this is why we were working and also practicing these new approaches to telehealth. So why emergency telehealth matters? Partially, I have already mentioned it, but here are some reasons. So telehealth bridges geographical gaps, ensuring swift access to medical assistance regardless of location. For isolated or underserved communities, telehealth acts as a vital lifeline, connecting them to healthcare professionals. Telehealth accelerates response times during emergencies, potentially saving lives. It is also important that efficient communication channels enables seamless coordination between patients, responders, and medical teams. And telehealth assists first responders by providing real-time guidance and expert consultations. One issue which is very important is also that we can provide mental health service during crisis, which is also an issue, especially in cases when people are without communication or they cannot move for several days. So, how to make the telehealth emergency effective? It's not so easy, although we have several tools available. The telehealth platform should prioritize accessibility. While this primarily refers to usability, it also encompasses the broader goal of making telehealth available to access and accessible to everyone. Also, other people can use our platform. The platform should be responsive, meaning it has the ability to quickly connect patients and providers, and it minimizes delays, which is especially crucial during critical moments. The platform should be reliable, which means that it should maintain reliable performance even in emergencies. It should provide for mobility, which means that it should be designed for use from any location, and it should enable on-the-go medical assistance. It is also important that the whole system is designed such that it can provide support also for tourists and people from other countries which happen to be in the affected areas. It should be cost-effective for both providers and patients, which means that it should be affordable for end users and cost-effective for providers. And it should ensure patients' privacy and data security by safeguarding sensitive information and prioritizing data protections. So these principles contribute to a resilient telehealth system that can be effective and that can effectively respond to emergency while ensuring patient well-being. So what are the requirements for a reliable and effective emergency telehealth system? So it should provide multimodal communication, which means that it enables communication through video, voice, and text channels. This is also a part of legal requirements in Europe. It should have intuitive and easy-to-use interface that requires minimal training and ensures that patients and providers can navigate the system effortlessly. Platform independence means that a telehealth solution works across various platforms like web, mobile, desktop, and it is compatible with or independent from different operating systems. So device independence is also covered by this. We can use any device. The platform should adhere to industry standards for interoperability and avoid reliance on, and should avoid reliance on specific browsers. And what is important, as also mentioned before, data privacy and security, which means that the platform should prioritize patient privacy and confidentiality and implement robust encryption, authentication, and secured storage protocols. So there are certain requirements that have to be met by such a platform. So our emergency platform is based on these principles. So it is accessible directly through web browsers, which eliminates the need for additional software installations. Patients and healthcare providers can seamlessly connect without any download requirements. This user-friendly approach ensures quick access and convenience. Well, we know that people today prefer applications, or applications that where they have to register, but this is not very appropriate for such circumstances where people have to quickly get access, and this is the best way to get quick access. Whether patients use smartphones, tablets, or computers, our platform works seamlessly across all these devices. We have tested that with users, and they seamlessly can also switch devices. This flexibility ensures that patients can receive care wherever they are and whatever device they use. Our platform also supports multiple communication channels, video, voice, and text. It can be connected to various advanced technologies, artificial intelligence, and things like that. During emergencies, healthcare providers can choose the most suitable mode of interaction, allowing for versatile communication. And of course, patient privacy is ensured with strong security measures. All content and channels information are encrypted from end to end, which ensures both confidentiality and data integrity during telehealth interactions. And the application is based on international and compliant with international standards. So the interface, is simple and easy to use. So the navigation is very simple. It has minimal clutter as only essential features are provided. We tested the interface, various interfaces with the users, and we came up with this minimalistic approach. So it is without any unnecessary elements. The interface is clean and focused. It has a responsive layout. It has an easy-to-use interface that adapts to different devices. Elements are precise without sacrificing usability, which is also important when we are using, let's say, small mobile phones. We should be aware that simplicity does not mean sacrificing functionality. It means making complex tasks feel effortless for users. Our platform has been successfully deployed in Japan, Croatia. We are testing it in Slovenia and beyond. It was developed to empower the deaf and hard of hearing community initially. We support different healthcare environments. Our work on the platform started during the COVID-19 pandemic. The platform emerged as a vital tool, and it was used by the deaf and hard of hearing community to access essential services. We are currently involved in diverse use cases and projects and actively participating in standardization efforts. And here I will turn it over to Masahito again.
Perfect for closing remarks,
Thank
please. You. Fascinating. Okay. I'd love to hear an hour of you, but...
I'm sorry. Yeah. So just last but not least, I'd like to comment on international standards, because solutions are out there. Lots of them are useful, very useful, but international standard is very important because otherwise people wouldn't know that they exist. So we're working with ITU, within ITU, International Telecommunication Union, but also with WHO, World Health Organization, to provide accessibility of telehealth services. And this is our solution is one of our recommended solutions. So I'd like to invite all of you who are interested to join forces with us to make a better international standard for accessible telehealth, as well as ICT technologies, so that people around the world can get access to ICT, especially within emergency situations, without barrier. Thank you.
Thank you very much. And I urge you, go to the chat because there were questions too. And again, I'd love to share this presentation. And I really am looking forward to hearing more and more in depth of what you're doing. And it's amazing how from a crisis, as you said, it started with COVID, great things can emerge.